Hi friends, hope all of you are doing great, hope all of you are happy, and this session, it is a quick bite, it is a small session on scurvy. Okay? Detail item we'll be studying later. Now you tell me what is scurvy. First point, it is vitamin C deficiency. Okay. Now vitamin C deficiency, why does it happen? Because he or she, adult avam, kutti avam, may not be eating vitamin C rich food, okay, which can cause vitamin C deficiency in the body. This results in scurvy. Now, vitamin C, what happens? See, vitamin C has many functions in the body. Wound healing help then it helps in iron absorption. It helps in collagen synthesis. So that is very important. It helps in collagen synthesis. And then a collagen. Can you hear me or am I? Okay. It helps in collagen synthesis. Collagen in the protein. One of the abundant protein in our body. So collagen is there in our blood vessels. Every blood vessels in the wall to maintain the integrity. We have collagen. Now, okay, not just in blood vessels. We have collagen in many tissues. Okay, in the corneal and ligaments, tendons, and in our organs also like liver, kidney. In many places we have collagen. But collagen korayuvanenkil, so collagen synthesis endu venam, vitamin C venam. Collagen koranyal, what happens? These tissues, the blood vessel organs they will start to show symptoms. Now blood vessel integrity maintain cheyyunnarana collagen aanu. So if the blood vessel and the wall under collagen under, so if collagen is less in the walls of blood vessels will become leaky and the walls become what? Very weak and they can tear and it can lead to what? Bleeding. Okay, so now because of that, okay, because in our bone covering in periosteum. So periosteum blood vessels under. So these small blood vessels, what happens in scurvy, because these blood vessels in the wall, they become what? Weak, because collagen is deficient here. And these blood vessels have tendency to get, they can tear. Okay, and bleeding can happen. This is called as subperiosteal hemorrhage. Okay, let me show you the picture. See, what happens? 1 second. Let me just keep me here. Okay, you saw the picture. Well, this can lead to what? Swollen joints. Basically, this is because of subperiosteal hemorrhage. Because when the child moves the limb, there is going to be pain. So the child will not move the limb, and this is called as pseudo-paralysis. Repeat after me. Pseudo-paralysis, it is seen in other conditions also, but here we are learning about scurvy, and scurvy we see pseudo-paralysis. So now read this question. Okay, let me again put me here. About pseudo-paralysis in infantile scurvy, nerve injury muscle weakness it is because of subperiosteal hemorrhage. The child, because of this hemorrhage, child finds it difficult to move his limb because there is hemorrhage there. Move ചെയ്യുമ്പോഴത്തേക്കും കൂടുതൽ വേദനയുണ്ടാവും. അപ്പോൾ കുഞ്ഞ് കാൽ അനക്കാതിരിക്കും. എവിടെയാണോ ജോയിന്റ് കാല് മാത്രമല്ല wherever there is subperiosteal hemorrhage, ആ limb അനക്കാതിരിക്കും. Okay, so it looks like paralysis, but it is not. It is pseudo paralysis. Important question. It is a PYQ. പിന്നെ scorbutic rosary differs from rachitic rosary. See, rickettsiലും നമ്മുടെ സ്കർവിയിലും we have got bead-like appearance. Can you see? Okay, look here. Okay, can you see the bead-like appearance here? Okay, so this is a case of rickets. And can you see? Okay, bead-like appearance here. Yes, this is scurvy. Okay, about എങ്ങനെയാണ് ഡിഫറൻഷിയേറ്റ് ചെയ്തതെന്ന് ചോദിച്ചാൽ scurvy it is going to be painful. Okay, it is going to be tender. These areas, it is going to be painful. Basically, it happens. See, these beaded structures occur because of subperiosteal hemorrhage. In the costochondral junction. That is why these beaded structures occur. Whereas in rickets, okay, rickets, you can see these beaded structure because of the overgrowth of the cartilage. Okay, and it's not going to be painful here in rickets. Alright, so that's one differentiating feature. Now try to do this question. In scurvy, okay, scorbutic rosary, how is it different from rachitic rosary? How is it different from rickets? See, scurvy there are tender swellings. Okay, tender swellings. Barlow's disease എന്ന് പറഞ്ഞാൽ infantile scurvy-നെയാണ് നമ്മൾ Barlow's disease എന്ന് പറയുക. ഇതൊക്കെ previous year questions ആണ്. Essential biochemical defect in scurvy. What is it? In scurvy, actually the problem is with defective collagen synthesis. Vitamin C വേണം proper collagen synthesis. So there is defective collagen synthesis. It is a PYQ. And that is it. Again, let me move myself so that you can read. Stay positive. Better days are coming. And I'll see you all in the next session. But before that, when you're learning scurvy, you cannot miss this. Okay? Please go through it. In another video, I'll tell you why we see these findings. Okay? Subperiosteal hemorrhage, Trommelfell zone, wide line of Frankel, Wimberger's ring, Pelkin's spur. So usually in the question paper, they'll just ask you to identify. They'll give you this X-ray picture and ask you the diagnosis. But you should understand things and learn. So when we have time, when we both have time, I'll explain why these things appear. Okay. So please go through this X-ray. It's very, very important. Image-based question, Anna. This is a case of scurvy. Okay. So that's it, guys. I'll see you all in the next session. Yeah. Stay blessed. Bye-bye.